During pregnancy, a woman can experience various complications. This is why it's crucial to be on constant care by specialists. These are high blood pressure, gestational diabetes, preterm labor, and nausea. Gestational diabetes develops gestation during pregnancy. It affects how sugar glucose is used in your cells. Gestational diabetes causes high blood sugar and eventually can affect the health of your baby and your pregnancy. Some risk of pregnancy is upsetting, but there is a good news. Expected women can help to control gestational diabetes by eating healthy foods, exercising, and taking medication where appropriate. Blood sugar control will help prevent a difficulty birth and keep you and your baby safe. Symptoms. Gestational diabetes does not show visible signs or symptoms for most women. However, it's better to take a medical care early, particularly when you're trying to get pregnant, so your doctor can assess your risk of gestational diabetes as part of your overall childbearing wellness plan. When you become pregnant, as part of your prenatal care, the doctor will check you for gestational diabetes. If you develop gestational diabetes, more regular checkups may be required. These are most likely to occur during the last 3 months of pregnancy, when your doctor will monitor the level of your blood sugar and the health of your baby. Other diabetes health professionals, such as endocrinologists, a registered dietitian, or a diabetes educator, may look into further checkups if required. They can help you learn how to manage sugar levels in your blood during your pregnancy. After giving birth, doctors will check your blood sugar again in a month and a half to ensure that your blood sugar is back to normal. If you have gestational diabetes while pregnancy, it's recommended to check your blood sugar regularly. The regularity of blood sugar checkup depends on the results of your first check after delivery of your baby. Causes. Body digests the food that goes into the bloodstream to produce sugar, glucose. Large gland pancreas, which located in the back of stomach, produce insulin. Insulin is a hormone that assists to travel glucose from bloodstream to the cells in the body, and it's used as an energy. The placenta, which connects your baby to your blood supply throughout pregnancy, produce high levels of different other hormones. Practically, all of these hinder insulin activity in your cells, increasing your blood sugar. Throughout pregnancy, moderate absorption of blood sugar after meals is common. As your baby grows, the placenta is producing more and more hormones, which offsets insulin. The placental hormones in gestational diabetes cause an increase in blood sugar to a level that can affect your baby's growth and well-being. During the last half of pregnancy, around 20th week, but not until later than that, gestational diabetes is usually developed. Risk factors. Every woman is at risk getting gestational diabetes. However, there are some women at higher risk. Gestational diabetes risk factors include age exceeding 25. Women over 25 are more vulnerable to developing gestational diabetes. Family history or personal history. Women who are more likely to be diagnosed with gestational diabetes are the ones who have prediabetes, and when blood sugar will be elevated slightly, it can be a reason to type 2 diabetes, or any close family member have type 2 diabetes before. Also, if you had it during a previous pregnancy, if you delivered a baby weighing more than 9 pounds, 4.1 kilograms, or if you had unexplained stillbirth, you are more likely to develop gestational diabetes. Overweight. If you are significantly overweight with a body mass index of 30 or higher, you are more likely to develop gestational diabetes. Complications. Many women suffering from gestational diabetes have healthy babies, except Uncontrolled gestational diabetes can lead to excessive levels of blood sugar and cause problems for you and your baby, including an increased possibility of having a C-section to deliver. Complications on your baby. If you're diagnosed with gestational diabetes, your child might be at risk of excessive birth weight. Glucose moves from bloodstream to the placenta, which then promotes baby's pancreas to make extra insulin. Baby grows large. Such babies may get birth injuries, and at the time of delivery, mother required to have a C-section. Complication on baby also cause syndrome of early birth, preterm, and respiratory distress. High blood sugar from a mother can increase her risk of early labor and deliver her baby before the due date for the baby. Or because the baby is big, her doctor can suggest early delivery. Those babies who are born early may have trouble with breathing, called respiratory syndrome. At this point, babies will need assistance with breathing until they grow. Low blood sugar, hypoglycemia. A woman who has gestational diabetes often experiences low blood sugar after birth her baby since their insulin level is high. This may trigger a seizure on a baby. Frequent feedings will normalize the amount of sugar in the baby's blood. Later in life, a baby may develop type 2 diabetes. If gestational diabetes won't be treated on time, babies might die before or shortly after their birth. Complications on a mother. A mother who has gestational diabetes at risk of preeclampsia and high blood pressure, which cause serious complications on the pregnancy and might threaten both mother and baby life. Diabetes in the future. During other pregnancies, a mother may get gestational diabetes again. In the future, this might lead to type 2 diabetes. However, healthy eating and lifestyle can prevent such serious complications. This is why it's important to reach ideal body weight after delivery for a mother. Prevention. When it comes to preventing gestational diabetes, there are no guarantees, but the healthier practices you may develop before pregnancy, the better. Eat healthy. Choose high fiber foods, low fat and low calories foods. Emphasis on whole grains, fruits, vegetables, and strive for variety to help you attain your goals without compromising your taste or diet. Stay active. Exercising before and during pregnancy will help you prevent the gestational diabetes from developing. Most days of the week, aim for 30 minutes of moderate activity. Take a walk every day. Lose some weight prior to pregnant. Doctors are not advising weight loss during pregnancy, but if you plan on getting pregnant, losing extra weight in advance can help you get a healthy pregnancy. Therefore, a healthy lifestyle, eating vegetables and fruits full of vitamins and nutrients, and staying away from unhealthy foods will help you to prevent complications with gestational diabetes or other diseases that can cause to your well-being and your baby's health.